Hello, I'm Dr. Robert Kaufmann. We're about to go beyond the terminus. Today we're discussing irrigation. Irrigation is an important part of endodontic treatment. Regardless of the irrigants you use and the concentration of the solutions, keeping the irrigant inside the canal system while trying to irrigate as close to the apex as possible is a constant challenge. Endodontists most often use some sort of thin syringe needle type combination such as a 29 gauge or 30 gauge Navi-Tip by Ultradent. These flexible cannulas can be side vented or have a modified tip design to try to prevent extrusion of irrigation out of the apex. Most research has shown that without some sort of activation of the solution, passive irrigation generally results in what's known as vapor lock, which is a creation of an air bubble at the apex of the canal during irrigation. This bubble generally can't be broken with a hand instrument, no matter how hard you try. We must apply energy to the solution by pumping the solution with a gutta-percha cone or using a device such as an Endo activator or ultrasonic tip. Other designs, such as the Endo-Vac, attempt to avoid this by irrigating in the opposite direction and using a vacuum at the apex. I found the Endo-Vac cumbersome and expensive to use. The small size cannula plugs fairly easily, but I'll freely admit that I haven't used it enough to pass judgment. Newer devices such as Sonendo's GentleWave claim to be very effective in removing pulp tissue. However, almost all the research that has been produced had been sponsored by the manufacturer or is an anecdotal evidence publicized by paid consultants. It remains to be seen whether unbiased, competently performed studies will confirm the device's effectiveness as shown in long-term outcome studies, and whether those results can justify its significant increases in treatment time and cost. There have also been some reports of the inability to dry canals and canal hemorrhaging. Lastly, many endodontists find the company's adversarial and overly aggressive marketing techniques to be unprofessional and objectionable. As shaping instruments get more flexible and canal diameters appear to be getting smaller to allow us to preserve dentin, it becomes increasingly easy to lock a tip into the canal, and that risks extrusion into the peri-apex and a momentary painful result for the patient. Injecting large amounts of irrigants periapically can result in some horrific disfiguring, swelling, and bruising. Sodium hypochlorite accents are easy to avoid with good technique. How do we prevent this? Well, firstly, use a tip that has good metallurgy characteristics and that bends easily to conform to the canal shape. Secondly, use stops and set them slightly short of the desired length. Control the tip, especially in teeth with larger apices. Thirdly, use common sense when it comes to final foramen size. If the apex is resorbed due to chronicity of the lesion, or if it is an immature tooth, be careful when ejecting the irrigant. Dr. Herb Schilder, the father of warm gutta-percha technique and my mentor, always stressed that there's a difference between ejecting and injecting. Fourthly, always keep the syringe moving in and out of the canal. Never lock the tip. One of the best ways to do this is to use one hand to irrigate, to move quickly in and out of the canal while using your opposite hand as sort of like a stop to prevent the tip from exiting too far. In smaller canals, my technique is to take one of these Navi-Tips and place it tightly in the pre-measured canal without extruding the irrigation. The trick is to use apical force on the needle and drive it apically and remove it before it locks. This is done to get the needle to take the shape of the canal. It's a nice way to see how the canal bends because the tip will emerge with a curve that fairly closely approximates the curvature of the root canal. Many times, you get a sense of why that rotary shaping instrument seemed to encounter resistance to placement. Canal bends sharply at that point, as confirmed by the shape of the removed Navi-Tip. Remove the tip from the canal and set the stop short of this length. Since the tip now fits intimately in the canal, it is important that you withdraw the needle slightly before you release the irrigant. A rapid in and out motion ensures that you never are in the canal long enough to lock the needle and cause apical extrusion. Most studies have shown that if you irrigate close to the apex, you're going to get some level of extrusion no matter how hard you try not to do so. The key is to keep this volume as low as possible, not lock the needle in the canal, and keep moving. In one of our subsequent trips, we'll discuss irrigants and which ones I use. Thanks for listening, and join me again when we take another trip beyond the terminus.